And as I left the room, I slid down the stairs and I hurt my back.
How did you...
And
I apologize, Ms. Moss. Please continue.
And I screamed because I was because I didn't know what had happened to me and I was in pain. And he came running back to help me and carried me to my room and got me medical attention.
Did Mr. Depp push you in any way down the stairs?
No.
During the course of your relationship, did he ever push you down any stairs?
No, he never pushed me, kicked me, or threw me down any stairs.
Ms. Moss, have you ever before today testified in any kind of court proceeding?
No, I have never.
Why did you decide to testify today?
Objection, Your Honor.
All right.
That's beyond the scope of what we just talked about.
All right. I'll sustain the objection.
Thank you, Ms. Moss. We have nothing further at this time. We greatly appreciate your taking the time to testify.
All right. Any cross-examination?
No, Your Honor.
All right. You're free to go. Thank you, Ms. Moss.
Thank you very much.
Thank you very much. Thank you.
All right. Your next witness.
Your Honor, we're calling Dr. Shannon Curry.
Could you just give us a moment to move the TV? All right, Dr. Curry. Good morning, Mr. Dennison.
Good morning, Your Honor. Plaintiff called Shannon Curry, Dr. Shannon Curry.
That's fine. Ma'am, you're still under oath, so please have a seat, doctor.
Good morning.
Good morning, Dr. Curry.
Good morning.
Can you remind the jury who you are and what you do?
Sure. I'm Dr. Shannon Curry. I'm a clinical and forensic psychologist, and I'm here today to rebut the testimony that was provided by Dr. Hughes.
Which of the opinions rendered by Dr. Hughes do you intend to rebut?
So generally speaking, there are three main categories that I'd like to talk about today. So the first is that Dr. Hughes misrepresented the tests and the results that she utilized in her evaluation. She misrepresented my testing and the results that I obtained in my evaluation. And she communicated in a manner, provided testimony in a manner that presented essentially her own opinions and the self-report of Ms. Heard as facts.
Okay, the first category you talked about was the misrepresentation of her own test methods and results. What do you mean by that? So
Dr. Hughes she stated that she administered 12 tests. In actuality, she used 8 checklists. About half of those were symptom checklists. The other half were checklists about experiences that people can have with domestic violence. And those are not appropriate for forensic settings. They are easily exploited.
Other issues that you intend to address relative to misrepresentation of own results?
Yes, so in addition to using these checklist measures, which are easily exploited in a forensic context, they're developed for research or treatment only. She also stated that these checklists revealed things that they simply cannot reveal, especially in this context. Let's see. She also misrepresented information, clear indications on several of the objective measures that she offered. And there were indications visible that Ms. Heard had essentially engaged in what we call response distortion. So clear indications of exaggeration on one of the measures that's specific to PTSD, clear minimization of symptoms, intentional, on another more broad personality and psychopathology-based measure that she gave to Ms. Heard, which she did not acknowledge.
Did you intend to address anything relative to the CAPS-5?
I did. So Dr. Hughes administered the CAPS-5 about 10 days after I did, almost 2 years after she initially tested Ms. Heard. And she did not administer the test appropriately. So she left major components blank. She didn't apply the scoring rules that are clearly outlined with the test. And yet she diagnosed Ms. Heard with PTSD based
Her hair
on
looks
that
like
assessment.
a cinnamon roll.
What about Dr. Hughes's use of the personality assessment inventory?
So of the tests that Dr. Hughes administered, 2 would be considered, of those 12, 2 would be considered what we call forensically relevant instruments, meaning that they're objective enough and they provide us with some information about how the examinee approached the test, that it would be appropriate for this setting where the examinee is going to have a natural incentive to present themselves in a way that benefits the outcome of their case. Now, on the PAI, there were clear indications that Ms. Heard was responding and obtained scores in a manner that's consistent with individuals who have a personality disorder. And there was also an indication that several scales, we call this a configuration. So you might have one main scale that you notice is elevated, then you look for additional subscale information to get additional information on what could be elevating that scale. And there was a configuration that showed that even though Ms. Heard had moderately elevated one of the scales that can be associated with trauma, that elevation is better explained by childhood or distant traumatic experiences like the complex trauma Ms. Heard reported experiencing growing up.
Okay.
Yeah. She used it as a weapon today.
That Dr. Hughes utilized checklists that are not appropriate for forensic analysis. Can you explain that?
Yes. So, as I said, in any sort of forensic context, whether it's a civil or a criminal matter, a person who's being evaluated is going to have major incentive to present in a way that benefits the outcome of their case. So you always approach the examination, I believe Dr. Hughes said, with a healthy dose of skepticism, but that alone is not enough. We have to operationalize that. So we actually have to administer very comprehensive objective tests that either control for attempts to manipulate the test results or reveal attempts to manipulate the test results, so that we're not just blindly accepting the results or the self-report of the examinee.
How many tests were administered by Dr. Hughes?
She said that she administered 12 tests.
How many of them were appropriate for forensic physical examination?
So the trauma symptom inventory is appropriate. It's an objective measure, and it does have 2 primary scales that look at how the person approached the test. The personality assessment inventory is an excellent test. It is a broadband measure, meaning that it captures not only symptoms of mental illness, but also general personality traits. That also gives us pretty detailed scales similar to that one test I administered, the MMPI, that tell us a lot of nuanced information about the way the person approached the test. She also administered a malingering screen that can be very, very useful, but not in this context. So it's called the Miller Forensic Assessment Symptom Test. It's a brief set of questions that you ask the examinee, and it's been shown by research to be extremely effective at identifying an examinee's attempts to fake a severe mental illness or psychosis. And psychosis is when somebody loses complete connection with reality. It's excellent for that purpose. It's actually been shown in the research to not be effective at all for identifying a respondent's attempts to fake PTSD, anxiety, or mood disorders. The questions are just too odd for somebody who has the wherewithal to be trying to have PTSD to enforce. They see through it. So she used that. That's a fine test, but not appropriate for this context.
Of the various tests that she administered, how many were these checklists?
8 of them.
All right, and what are you talking about specifically?
Okay. So I had mentioned that there were 2 main categories of checklists she used. The first is the symptom checklists. Those included the Beck Depression Inventory. It's a brief inventory of items that essentially show all of the symptoms of depression that a person might have, and you rate which level of severity you have for each question. She also gave the Beck Anxiety Inventory, very similar, but just with questions about anxiety. She gave the Mood Disorder Questionnaire, which is a very brief, again, checklist. It shows symptoms of bipolar disorder. Bipolar disorder is a mood disorder where you might have an extended manic episode and then a very extended depressive episode. And then she gave the Post-Traumatic Stress Disorder Checklist. And that is a screening instrument only. It contains every single symptom of PTSD. So there's a secondary danger here too. When you think about it, given that PTSD is the most frequently feigned and claimed diagnosis in civil courts, if you're handing somebody a checklist that lists every single symptom of PTSD, you're essentially teaching them all the little nuances that we're looking for to give that diagnosis. So she gave that to Ms. Heard. Ms. Heard endorsed most of the items, and Dr. Hughes diagnosed her with PTSD and substantiated that opinion by Ms. Heard's checking those items on the PCL-5.
Yeah, that's pretty fucked up.
Were there another group of checklists that Dr. Hughes used?
Yes, so she also, and I forgot one on the last because I don't think of it as one, but previously I'd explained, and I do not expect you to remember, it's called the Life Events Checklist, which is just an inventory of experiences a person may have gone through that are traumatic. Dr. Hughes also used that, and that's appropriate to use before the clinician-administered PTSD scale, the gold standard CAPS-5. However, she administered this long ago before she gave the CAPS-5. Now that going on to the second group, there were 3 checklists that she gave that are specific to abuse. And the first she gave, the Danger Assessment Scale, was actually developed for use by nursing staff in an emergency room setting, specifically for female victims of intimate partner violence. The purpose of this is important because our forensic ethics, our psychology ethics, talk a lot about relevance. Is the test relevant to the purpose? And the Danger Assessment Scale, its initial purpose was completely different. This was developed to show high risk factors for dangerousness and pretty much to help a female who is in an extremely abusive partnership, who is in the emergency room with extreme injuries, to stop rationalizing, because if she has to check off all the things that have happened that year that have been dangerous, does he own a gun, has he, I won't go into all of them, but the more she checks off, the more likely it is that she might realize that she is in imminent danger and then accept resources offered by the hospital and social work to protect her. That was the purpose of this scale. It was never intended to be used as a retrospective measure to look back in time and find out whether abuse was occurring based on one person's report years later in a litigation. She also gave the Conflict Tactics Scale, revised, the second edition. Similarly, this scale was developed for research purposes. to research family violence. Again, there is no control for exaggeration or minimizing. It was just given to research participants anonymously so that we could get data on the prevalence of abuse and how abusive dynamics work. And on that, there's 39 questions where the respondent indicates essentially certain abusive behaviors they may have engaged in, and then 39 where they indicate behaviors their partner might have engaged in. And obviously, you can understand that in a forensic setting, the respondent is likely to put a very minimal amount of behaviors they engaged in, and then extremely increase the number of behaviors their partner might have. And then lastly, let's see, the abusive behaviors observation checklist was the third checklist she gave. This one has not, there's no known research even on its effectiveness for what it was developed. It's a theoretical, very brief checklist that was meant to be used for therapy, where an individual who had experienced domestic violence could essentially read through some of the behaviors that constitute violence that they might not have been aware of. And if those behaviors applied to them, or if some of those coping strategies were ones they utilized, they would check that off, and then they have a way to talk about it because now it's been put to words. Again, this is similarly problematic if you're in a civil litigation, the person's motivated to have the results be consistent with a claim or an allegation of intimate partner violence and an allegation that they've been severely harmed, then they could simply just check off more. And not only that, but checklists like this one specifically give a lot of nuanced information about what clinicians might be looking for when they're assessing whether violence was present or whether the person's self-report is consistent with a genuine self-report of having been victimized. They're given all that information that we might be looking for.
Can you talk specifically about Dr. Hughes' use of the, I think you called it the PCL-5?
Yes. So the PCL-5 is the post-traumatic stress disorder checklist. This is different, not to be confused with the CAPS-5, which I've talked about previously as being the gold standard. The PCL-5 was developed by the National Center of PTSD. It's intended for treatment. So if I were, for instance, working with a service member who I know had been in combat, I would probably give this as a standard with my intake. Before we do the diagnostic interview, it kind of gives me a read on how somebody who's there for treatment, who we assume can be taken at their word because if they give us correct information, they're going to get an appropriate treatment. And if they give us incorrect, they might not get the treatment they need. So I would give this checklist to them, and then if they recognize some of those symptoms of PTSD, they could check it off. And that would probably indicate to me that I need to then do the next step. If they're checking off more items than not, I would probably decide to administer the clinician-administered PTSD scale, that gold standard interview, to find out more about a diagnosis.
The last thing is what everybody refers to as the CAPS-5?
Yes, the CAPS-5.
What about, well, you talked about forensic use. What do you mean by that?
So when I'm talking about forensic evaluation, that's an evaluation that isn't done for therapy or treatment. It's specifically to assist the fact finder, to assist the judge or the jury in the court by providing information about the psychological status about an individual. And that's an important delineation too. We are not psychologists. I wish we were mind readers. I wish we had a crystal ball and find out whether intimate partner violence occurred and look back in the past, but it's nothing like that. Really, it's a lot less interesting. We look at data. We have to control for those response biases. And then we also are looking at functioning, which is really the bottom line of the assessment. Did the person have a change in functioning from before the alleged trauma, or in this case, the alleged IPV, to after? Is there a decline in the way they're going about their lives?
And Your Honor, may we approach?
All right.
Okay, looks like they're just talking it out at the moment. All right. We'll see what happens from here. Looks like there's some people in the chat. Feel free to say hi. If not, that's okay. You can chill and watch with me. Excuse me. Had an itch, and unlike Amber Heard, it's not because I put makeup in my eye, or not makeup, that thing in her eye that try to make her look like she's actually crying when she's not. Alright, while they're talking it out, I'm going to check something. No. What the? Oh, yeah. Cool. Can I do one right now? I'm just going to check and see if it works, because if I can, then I can do that during downtime.
Are just too odd for somebody who has the wherewithal to be had moderately elevated one of the skills that can be associated
Dr.
with trauma.
Curry,
That
All right.
let's
I'll have
look
to switch
back
it back
at
to later. But it's cool. I can do
some
that.
of those domestic violence checklists that you were talking about.
okay.
And did you see any problem with the use of those?
Yes.
What problems did you see?
Well, Doctor, first of all, they shouldn't be used. So we do have professional standards that require that we utilize instruments that are relevant and appropriate for the particular setting, and that we substantiate our opinions based on data that is reliable from tested, accurate, reliable tests for the purpose. So there's that. It's inconsistent with the ethics. And essentially, they just shouldn't be used. They don't provide us with the robust information that it would be expected in such a high-stakes setting.
Would you have expected Dr. Hughes to comment on the limitations of the checklist she was using?
Yes. So, first of all, Dr. Hughes provided opinions based on these checklists. So she referenced especially the danger assessment scale several times throughout her testimony, stating that Ms. Heard was in a very dangerous situation. We also have an ethical guideline and a professional standard as well that indicate that whenever there is question about the reliability and the validity, and in psychology we use the term validity to talk about accuracy, of any of the methods that we're using to collect data, we clearly communicate not only that there are limitations to our opinions, but we also need to provide the fact finder with information about what the potential implications or impact could actually be. So, for instance, if we use a scale that's idiosyncratic for the purpose, but we would first need to explain why we made that decision to not follow standard procedures. And then we would need to explain the use of this scale might introduce some potential exaggeration of this symptom, and so I'm trying to control for that way, but that was one of the limitations of my opinion. You have to make it very clear. Transparency is really at the center of good science in general.
You talked a little bit about ignoring response distortion. What is response distortion?
Response distortion is a term that speaks generally about an examinee approaching a test and providing answers that are either exaggerated or minimized, but in some way an inaccurate representation of their current mental status or their experience.
What test do you believe that Dr. Hughes failed to acknowledge response distortion on?
So she administered the personality assessment inventory, which is similar to the test I gave, the MMPI-2. It's that general broadband measure of psychopathology symptoms and personality traits. It includes several scales that are very good at detecting either exaggeration, minimization, or even trying to claim that you have unusually good qualities. On that test, there were clear indicators that Ms. Hurd, very similar to the way she approached my MMPI, engaged in defensiveness. And in fact, there's a function that you can look at. So you have that main scale elevation, we call it positive impression management, was elevated. And then, because we want to make sure that somebody isn't elevating that scale just because they have such well-being, there are additional configurations of scales that you can look at to find out what's going on. And so the Cashel discriminant function is sort of the name of one of these configurations, these equations that are done. And she was highly elevated on that. In fact, that elevation tells you that no, this isn't accidental. This isn't because she's just doing so well in life that she has an extremely, extremely low amount of problems. No, this is an intentional over-reporting, or I'm sorry, an intentional effort to minimize any appearance of having problems.
Wow.
Now, you may have addressed this, but there was a reference to malingering.
Yes. So what's interesting about Ms. Hurd's approach to different tests is that it seems to be influenced by what we call the face validity of questions on the test. So if a test looks like it's measuring PTSD, you see exaggeration on her validity scales. If the test has less face valid questions, for instance, the personality assessment which Dr. Hughes administered, the MMPI-2 which I administered, where she can't quite figure out what the questions are asking, they seem really banal in general. On those, you see extreme defensiveness, minimization of any potential pathology, essentially presenting herself as perfect and free of any mental illness or personality disorder. But on the trauma symptom inventory, which Dr. Hughes administered, that was the one that I previously indicated for ease of explanation. When the test results come out for how the person approaches the test, that test itself prints it as a percentage. And there's a really excellent scale for finding out if a person is exaggerating their symptoms of PTSD. It's called the Atypical Response Scale.
Okay.
And the TSI-2 is the revised version of this test, and that scale was improved this time around to really try to be a clean indication of, is this person exaggerating? And it puts quite high questions in the test that are so unusual. They might sound like PTSD, but even the most severe cases of PTSD don't have these symptoms. And so somebody who's intentionally trying to exaggerate PTSD, or possibly unintentionally, but nonetheless who's exaggerating it, is likely to endorse these items even though they're not real PTSD symptoms. Ms. Hurd scored so highly on this that even if there is, although Dr. Hughes correctly said there tends to be a negative skew when people have the high levels of distress that's associated with PTSD, so sometimes people score higher on this even when they do have PTSD. She scored so high that that is effectively ruled out as a possibility.
Okay.
What about Dr. Hughes's administration and use of the CAPS-5?
Okay, yes. So Dr. Hughes had diagnosed Ms. Hurd with PTSD back in 2019 when she began testing her. It wasn't until 2 years later, more than 2 years later, 10 days after I administered the CAPS-5 with Ms. Heard, that Dr. Hughes held an impromptu evaluation session remotely with Ms. Heard and administered the CAPS-5. She had previously diagnosed PTSD without using what we consider to be the gold standard PTSD diagnostic interview. And again, when we're doing a forensic evaluation, it is an important responsibility, and part of our ethics and professional standards are that we document everything to allow for transparency and full judicial scrutiny. And Dr. Hughes administered incorrectly. She left huge sections, very relevant sections, blank. There's no way to understand why she scored it as high as she did based on the information that's provided. You're essentially supposed to notate the examinee's responses as verbatim as possible to explain your reasoning and implying their scoring procedure. It's a standardized test, and if you don't follow those standard procedures, it's completely invalid. Not only that, but it looks as though Dr. Hughes further invalidated it by trying to show that she had assessed for the childhood trauma impact, and she had said that she went back and asked the childhood question, but you can't do that. If you're assessing for two separate periods of one's life to find out their relatedness to PTSD, you do two separate CAPS interviews, period. You don't create your own question system. That is non-standard administration of the test, and it invalidates it.
All right. You also mentioned, with respect to the PAI, or the Personality Assessment Inventory, that Dr. Hughes failed to mention some elements. What did she fail to mention?
Oh, okay. So on the Personality Assessment Inventory, so first she failed to mention that there were clear indications of response distortion. She also failed to mention that Ms. Heard scored in her score profile against their main scores. She did elevate a score for the borderline personality disorder sort of section, but that in and of itself would not indicate a diagnosis. However, the configuration of her scores overall is consistent with that, and in fact, it's one of the diagnostic suggestions given by the test itself. And then also, there's a configuration around Ms. Heard's trauma responses on that particular test, which demonstrates that it is more likely that those symptoms were reported in relation to something in the distant childhood. It's more consistent with childhood chronic abuse than present circumstances or recent circumstances.
Okay, I think you said, in addition to the issues with her own testing, Dr. Hughes misrepresented your results.
She did.
Can you tell us how?
So, I would say the main issue was that she said that Ms. Heard obtained a normal profile on my MMPI-2.
All right. How do you disagree with Dr. Hughes relative to the profile?
Okay. So the profile was not normal. So Ms. Heard already had subtle elevations just by the test by itself as it came out. There were subtle elevations, but they were elevations that, if the validity scales hadn't been as elevated as they were, you might have said this person has some traits, but this isn't necessarily at the level of a true pathology. However, Ms. Heard elevated a scale that essentially is a defensiveness scale on this test. And when you're giving this test, you always are mindful of different norms or groups who may have similar profiles. And there are certain groups of litigants who tend to elevate this scale as well, so I had that in mind. However, Ms. Heard elevated this so much that it was far beyond the mean for the litigants that are known to have the highest levels of this scale, this defensiveness scale. And when this scale is elevated to the level that it is, you automatically understand that it is very likely that those clinical scales, I keep doing this because I'm seeing it in my head, it looks like sort of an ECT. It's sort of these peaks you see on a graph. And when you see these peaks, and you have this huge peak over here for the defensiveness scale, what you know is that these peaks are artificially, they've been lowered or suppressed based on the respondent being so defensive. They still detected what's likely there for her, but it's not as high as it should be. So you make an adjustment. And the recommendation is that anything at 60 or above, we call it a T-score of 60, or above is considered significant. Ms. Hurd's were already over 60. Some were quite higher than that. And then you see a very clear profile. And that was how I got that. I had mentioned a 3-6 code type. Now, the test does its own correction also for some of the scores, but not the ones that are her main code type. With the test correction, she had a 1-3-6 code type, which is very similar.
What is a 3-6 code type?
A 3-6 code type is something that has been researched and found to be highly correlated or probabilistic of certain behavioral tendencies and personality traits. And the traits with a 3-6 code type tend to be marked by a lot of externalization of blame, a lot of denial about one's own personal faults.
Okay, yeah, that sounds
intentional
like her.
or not intentional, but just extreme denial. Hostility that is strongly controlled and suppressed. The person may not even realize how hostile they are, but family members, those closest to them, are very likely to report that they lose their temper, and when they lose their temper, it explodes. We have sort of what we call a cookbook for these code types, which will provide you with all the information that's been researched to be associated with them. And our cookbook actually states that 3-6 profile specifically tends to be associated with cruel and ruthless behavior, particularly to those who they perceive as less powerful than them and subordinates.
She sees everybody as less
Describe to the
powerful
jury
than her.
the review process that you went through relative to the MMPI.
So I conducted a very methodical analysis of the scores. I do this for every test, and I also did it when I was reviewing Dr. Hughes's scores. So what you haven't seen that's in Discovery is that I created a 25-page outline just of her scores with, and it's sort of a table. So I'll put the score, I'll do it in sections so that I can understand different groupings, different research studies, and I start with looking at all the validity scales. So I put in the score, and I'll even color the table to show me if it's kind of in the high zone, moderate zone, or low, and then if it's low, is it a significant low score, or is it just low so it doesn't mean anything? And then in the right side, I put all the research data that I found on this particular scale score. And so I start with the validity scales, the way the person approached the test. Then I go down to essentially, we call these the first factors. So their overall sense of well-being and how well they cope. On this, actually, Ms. Hurd's, she endorsed scores or endorsed items that were the opposite of PTSD. So really saying that she feels free of distress and that she views herself very well. So then I go down to control, self-control, loss of control, coping abilities, and I put in the scores that are associated with that in the research and the test development. Then I go down to clinical and personality pathology, and I look at all the scores that are significant there, first with the top-level main scores, then with all of the different sub-scores, again, citing the research, the meaning, the level of elevation, and what that means. And then I do comparison with different research groups. So for Ms. Hurd, I did a section that looked at all sorts of different scores that have been implicated with a PTSD presentation to see if any of those were consistent. I can't remember how many there were. I think I put 13 on there, but I could be wrong. But I believe that there was only one that could even be, in some research, is sometimes associated with it, but it was general anxiety, which turned out to be more trait specific. I looked at the scores that are typical of women with IPV. Hers were not consistent at all with those. I looked at the scores that were consistent with people who are frequently in litigation. Hers actually were very highly correlated with those. That tends to be also consistent with a 3-6 code type, and the reason for that is believed to be that they tend to perceive themselves often as victims who need to avenge wrongs.
Were there other results you believe Dr. Hughes to have misrepresented?
I bet.
For instance,
Whatever.
the TSI-2.
Yes. So Dr. Hughes generally said that testing supported PTSD and that there was an etiology for her trauma of intimate partner violence. She did reference that essentially I can't remember if she said that the trauma symptom inventory indicated PTSD, but
really
she did say
random,
that the elevation on that validity scale is consistent with PTSD, and that's simply not true. That scale was designed and has been tested and shown to be there to show when somebody is endorsing extremely unusual items that are not consistent with PTSD. And even though when some people are experiencing PTSD, their distress level is so high that they'll engage in what we call a cry for help, and they may sometimes exaggerate distress. Again, when you're looking at scores as high as Ms. Hurd's,
It's cool you got retro
and then
critics
you're not
emojis in
seeing
there.
indications of PTSD in the more subtle tests where she doesn't know what she's endorsing, it's good evidence that her over-endorsement on that one test is because of the reason the scale was made, to detect exaggeration and feigning of symptoms.
Your hair is ridiculous right now.
Is this the test that resulted in the 98th percentile
Yes.
score?
Yes, on that atypical response scale.
And what does that 98th percentile score represent?
So that 98th percentile score just represents that among 98% of people who take that test would not have endorsed. She scored more of those unusual items that are not consistent with PTSD than 98% of people who have ever taken that test.
Does that relate to this concept you talked about before called feigning?
Yes.
What is feigning again?
Well, feigning is essentially exaggerating symptoms of a disorder.
Yeah,
I think the
exactly.
third
It does look like
thing
a
you
sad
indicated you were going to talk about was self-reports and personal opinion as facts. What are you talking about there?
So in any science and in psychology specifically, it's really important that we use precise language and we say what we mean, and we do not present opinions as facts, because when you are in the role of an expert witness or an expert in any setting, essentially a layperson may not be able to detect the difference between something that is a personal opinion that you're giving versus something that is substantiated by research data, test data, reliable test methods. So our ethics talk about, especially the specialty guidelines of forensic psychology, the responsibility we have to distinguish between data, then inferences we're making from that data, what the data can mean, sort of like those tables I do. I put the data, the inferences based on the research, and then what my ultimate opinion is, integrating all of that data. And it's very important that we clarify that to the fact finder, to the judge, the jury. That's our responsibility, that we do not cloak personal opinions or the self-report of an examinee as an expert fact or somehow scientifically based when it is just a personal opinion or self-report of an examinee.
What do you mean by self-report?
The self-report is essentially what the examinee tells you during the interview.
Okay. When did Dr. Hughes do this most?
Well, it's actually morning right now. You're
She
in the
did
UK,
this
different
most
time
when
zones.
describing
I guess afternoon over
instances
there,
of
but it's
alleged
7 a.m. over here. I
IPV.
don't usually work this early.
And there's also an issue there because one of our ethics also discusses the importance of relevance and withholding, essentially constraining our testimony to the data and not incling private information, personal information that unnecessarily compromises the dignity of any of the litigants. She provided a lot of what was Ms. Hurd's report to her, the allegations of abuse, when describing Mr. Depp, who she had not examined, when describing Mr. Depp's behavior, his motivations. I believe she used the word obsessive jealousy quite a few times, talked about Ms. Hurd being in a highly dangerous situation. These are simply things that we cannot detect based on testing and a psychological evaluation. We have to evaluate the person, we have to get consent, and we can only describe an individual, not whether or not IPV has occurred. And we certainly shouldn't go into explicit details about sexual encounters or other things that are highly prejudicial, shocking, and hard to forget.
Okay.
Dr. Hughes says that Ms. Hurd has PTSD. Do you agree?
I do not.
Why not?
The results
I heard that there
of
was
my
a court case in
multi-method
regards to the
comprehensive
Ukraine war.
evaluation
Somebody,
based on
Russian soldier,
carefully
is being
selected, researched,
executed,
relevant test instruments, based on comparing those instruments to Ms. Hurd's self-report, observing Ms. Hurd's behavior over 12 direct hours of assessment, reviewing copious notes from prior therapists who indicated symptoms in their notes, reviewing the notes of Nurse Filati, previously Nurse Borum, who spent, I believe at one point, almost 2 months with Ms. Hurd daily.
Oh, that's right. Sent
Reviewing
to jail
the notes
for
of
life.
her
That's
treating
what it was,
providers.
For
Let's see.
killing civilians. I think it
All
was.
of the legal documents and discovery. There was no evidence of PTSD.
I'm not sure if you're aware of this, Bad Wolf, but yesterday
How is evidence of PTSD generally?
there was a mass shooting at a
it's a-
Texas elementary school.
So
Really sad.
really the bottom line in
I
a
was thinking about
forensic
posting a
psychological
short about it, but I
evaluation
decided not
is
to.
a change in functioning. That's what we're looking for. Again, I said we don't have a crystal ball. We're not wizards. We can't get into somebody's head. What we're looking for were there identifiable changes in the way the person engaged in their world. Were they able to keep a job? PTSD is an extremely disabling diagnosis.
Okay.
When a person has true PTSD, it is difficult for them to work. You'll see unemployment, job loss. It causes extreme levels of distress and impairment. There's divorce. There's
Clearly no sign of that
isolation and
Amber at all.
estrangement from children, from family members. Extreme alcohol abuse, often a string of sudden DUIs when the person never had any before. They become homebound. They can't go to the store. They're certainly not going to events. They're not having success in their film career,
I only
usually.
mentioned it
They're
because
not
you were talking
exercising
about
every day, pursuing their
Great.
hobbies, being avid readers, obtaining level 3 sommelier training, having dinner parties with friends, speaking to public groups. Those are just indications of very high functioning. And when you're looking for a decrease in functioning over time, that is inconsistent with that decrease.
What about Dr. Hughes' suggestion that Mr. Waldman's statements served as a trigger for Ms. Hurd's PTSD?
All right.
Okay, it looks like they're doing an approach right now. I'm gonna check on some things. What's this? What? A blank text message? Oh my. My wife just sent me a GIF. Which reminds me, there was something else she sent me some time ago. It was a lot of fun. There was a short I posted talking about how once again, Amber Heard's lawyer cannot get a question across because in the case of that, Waldman had a client attorney privilege and was not required to answer questions that were client attorney privilege. And yeah, there's that. Flat out liar. But what was I gonna say? After that, the trial actually got really boring, and she just made this crazy noise. And I was like freaking out. I was like, "What the hell happened?" And then she told me it was because they were finally on lunch break. I saved it somewhere on my phone. I was gonna play it right here on the stream.
Dr. Hughes had suggested that perhaps Ms. Hurd's PTSD was somehow triggered. What's your view on that?
I would say that it can't be triggered if PTSD isn't present.
Thank you very much, Doctor.
Okay.
All right.
There you go.
Cross-examination.
this.
Dr. Curry, I just want to make sure that we all remember, you're not board certified, correct?
No, I'm not.
Okay. And you've been licensed for how long?
I've been licensed for 10 years.
Okay. And you are being paid by Mr. Depp's legal team to be here, correct?
Yes.
How much have you charged so far?
I actually don't know.
Over 100,000?
I truly don't know. I don't do my own books.
Over 200,000?
I don't know.
She keeps telling you I don't
Over
know.
300,000?
Can you stop
That
asking?
would be way too much, but I do not know.
Okay. Now, just so that we all remember, you had dinner at Mr. Depp's house for 3 to 4 hours with Mr. Depp, Mr. Waldman, Mr. Chu, and Ms. Vasquez, correct?
I was interviewed. I asked if there was anything I could eat because at about 3 hours I started to get hungry. Mr. Depp then offered to order takeout for the entire team.
Oh, how
So
nice.
you had dinner with
A much
at
nicer
Mr. Depp's home with Mr. Waldman, Mr. Chu, Ms. Vasquez, and Mr. Depp, correct?
Yes.
And you had drinks as well, correct?
I actually don't know. I do remember that there were drinks.
Do you recall testifying
IRS is gonna
earlier
get her.
that you did have a drink, a mule something?
No, I remember testifying that there might have been a mule, a Moscow mule.
Okay, thank you. We didn't have animals there as well, right?
No animals.
Okay, that's good to know. And you talked about
Yeah.
transparency. I just want to make sure you had several designations, expert designations and reports in this case, correct?
Yes.
And in not one of them did you disclose that you had dinner and drinks at Mr. Depp's house for 3 to 4 hours with Mr. Waldman, Mr. Chu, and Ms. Vasquez.
Why is
Is
she
that
not
correct?
looking forward?
Ms. Bredehoff, you're mischaracterizing what occurred.
Dr. Curry, please answer the question. Not once did you disclose this in any of your
I
reports,
did not
correct?
disclose that I was interviewed as that standard procedure.
But it's true that you have never gone to a client's house to be interviewed for an expert witness position, correct?
Yes, because I never had a client that was essentially homebound because of their celebrity status.
All right. And you
Okay.
talked to Mr. Depp for 3 to 4 hours before taking on the role
Oh, okay.
of assessing Ms. Heard and deciding whether she was suffering from any distress, correct?
I did not talk to Mr. Depp. I was talking to his legal team, and he was there to observe.
He was
Okay.
present for the 3 to 4
Yes.
hours. Oh, and are you saying now he just stayed silent and said nothing all day?
I don't recall what he didn't or didn't do. I was answering questions.
Okay. Now, your expertise here is limited to whether Amber Heard suffers from PTSD currently.
But she
Is that
clearly
correct?
doesn't.
Yes, I was tasked with conducting an evaluation to
Okay.
determine
Dr.
Ms.
Curry,
Heard's mental
We're all on
status.
very, very strict time limitations
Okay.
because we've promised to get this case to the jury. So I'd really appreciate if you just answer my question rather than trying to go further,
Sure.
okay? Thank you very much.
Yeah.
Now,
Hypocrite
after
Amber
you did
Heard
have the
always
dinner, you then
answered
provided a
long-windedly.
designation in February of 2021 in which you said, and this is long before
Okay.
you ever saw Amber Heard, correct?
I'm gonna go back to
You
the
said that
YouTube
Amber
tape.
Heard, quote, exhibits patterns of behavior that are consistent with co-occurring cluster B personality disorder traits, especially borderline personality disorder, end of quote, correct?
No,
No, we went through this before.
we did.
But, and that was on the designation, was it not?
I told you last time that I did not write that.
Okay, and you
My
don't know who
goodness.
did on the legal team, correct?
No.
Okay, and then I also asked you, if you may recall, whether you listened to the audio recording in which Mr. Depp taunted Amber Heard that she had a borderline personality disorder. Do you recall that?
I recall you asking me that, yes.
Did you recall listening to that audio tape?
I don't recall Mr. Depp taunting Ms. Heard. I do recall that he at some point suggested she might have that diagnosis.
Okay, and that was back in these audio tapes back when they were together, correct?
Excuse me.
Yes.
Okay. Now, you've never before been asked to testify or serve as an expert with respect to someone who has bipolar disorder, correct?
No, as I previously stated, that's not true.
All right. My extra copies were all distributed before. Does everybody have those?
Not up here anymore.
Okay. My apologies, but I'm going to go ahead.
Your Honor, can we approach?
All right.
what she's doing.
Now, you recall testifying in your deposition on March 21, 2022, correct?
Yes.
And you were under oath at that time, correct?
Yes.
And the question I just showed you on
Usually you
page
are.
207, line 5, have you ever been asked to testify or serve as an expert with respect to whether someone has bipolar disorder? And your answer at that time was no, correct?
Yes, I had forgotten that case.
Okay. And have you ever been asked to testify whether anyone has behavioral or characterological conduct that suggests they may be an IPV perpetrator?
I can't, yeah, I may have. It's difficult. After about 250 cases, it's difficult to remember specifically.
All right. And have you ever been qualified as an expert in the area of IPV?
No.
And have you ever been qualified to testify as an expert in domestic abuse or violence?
Domestic.
Abuse or violence?
Yes, that's been a component of testimony.
Okay.
Right.
I don't know what she just said there. That was weird.
Can I take a look? You want? Okay.
Line 16 of page 207, have you ever been qualified as an expert in the area of IPV? Your answer on line 20 was no, under oath, correct? Then the next question, have you ever been qualified to testify as an expert in domestic abuse or violence? That and goes into page 208, line 4. The answer then under oath was no. Now, you would agree that the literature is quite clear that trauma-based symptoms such as PTSD or complex PTSD have symptoms that overlap with borderline personality disorder and histrionic personality disorder, yes?
Yes.
Okay. And you would agree that it's important to use valid and reliable measures for an accurate diagnosis, correct?
Absolutely.
Okay. You chose, however, not to administer the structured clinical interview for DSM-5 personality disorders, the SCID. Is that correct?
I did.
Okay. And would you agree that that is a state-of-the-art structured clinical interview?
Not for a forensic evaluation with a sophisticated examinee.
But to determine if a personality disorder is present?
No, not in this setting.
You don't agree with that?
I do not.
And you don't agree that that is the gold standard assessment for reliable, accurate psychiatric diagnosis?
It's a good one, but for treatment settings especially.
Okay. Now, did Ms. Hurd, you said you talked about, you read all of the treatment records, right?
Yes.
Okay. Do you recall reading the treatment records for the psychologist Bonnie Jacobs, who saw Amber Heard over 5 years?
I do.
And did you see anything in Bonnie Jacobs' notes over 5 years in which she diagnosed Ms. Heard with borderline personality or histrionic personality disorder?
No.
Now, you also saw the notes of Dr. Connell Cohen, correct? Mm-hmm. And you even attended his deposition, correct?
Yes.
All right. And he saw Amber for roughly 2 years. He was part of the Dr. Kipper connection,
Mm-hmm.
right?
Yes.
Correct? Okay. And did you see anything in Dr. Cowan's notes And did he say in his deposition that he diagnosed Amber Heard with borderline personality disorder or histrionic personality disorder?
I saw the symptoms clearly delineated throughout his notes and in his deposition. He does not use diagnoses, so he would not have diagnosed her.
He said specifically in his deposition he did not diagnose her with that, correct?
Yes, and he also specifically stated that he does not use diagnoses.
All right. And you also have seen Dr. Banks, Dr. Amy Banks, the psychiatrist, her deposition, correct?
Yes.
And did Dr.
Not her
Anderson,
deposition. I reviewed her notes in the transcript.
all right. Did Dr. Anderson diagnose Ms. Heard with borderline personality disorder or histrionic personality disorder?
I don't believe she provided any diagnosis since she was a couples therapist.
All right.
Oh,
Now,
okay.
you've said quite a bit about Don Hughes, but do you remember how many years of experience Don Hughes has in IPV and domestic abuse and violence?
I know it's quite a
God.
bit.
Extensive, and
has,
she
like,
is board
this
certified, correct?
Yes,
book
she
where
is.
she
All right,
thinks
and
she's
she
better than
spent
everybody.
29 hours of examination with
So
Amber Heard,
irritating.
did she not?
Yes, mostly
Okay.
interviewing.
All right, and she interviewed
That's a
her
good point.
therapists, Bonnie Jacobs and Conan Cowell, correct?
Yes,
And she also interviewed Amber's late mother.
yes,
Okay, and she administered 12 different tests over the period of that time, correct?
Well, as I said, the majority of those were checklists, which are inappropriate for the forensic setting.
I understand that's what you say, but she administered 12 different tests, correct?
If you want to qualify them as tests, sure.
Okay. And so you disregard, no, I'm not even going to say that. Okay. Let's go to the CAPS-5 and PTSD. Now, you assessed Ms. Heard's traumas in her life, correct?
Yes, I did
Okay.
give her an instrument to assess for any trauma exposure throughout the entire lifespan.
Yes, that's fine. And you wrote that Ms. Heard's exposure to a traumatic event, namely one of the sexual assaults by Mr. Depp, more than satisfied this requirement. Did you not write that in your notes?
That is not what I wrote in my notes. Do you have my notes? So we
And
can
you
look at them?
administered a structured clinical interview based on that trauma, correct?
Not exactly. It's not quite right.
Okay. Now, Dr. Hughes administered a full intimate partner violence assessment, correct?
That's not a psychological assessment. We can't assess for intimate partner violence. That's an event.
Dr. Hughes administered a full intimate partner violence assessment,
She
correct?
stated that, and that's actually something I'm rebutting today.
Okay, and
Okay.
you reviewed her psychological testing?
I sure did, yes.
Okay, and are you aware that in September 2019, Ms. Heard had a trauma-based symptom on many of those valid tests?
Can you be a little bit more specific? Many of those valid tests, which tests are you talking
Do
about?
you have a recollection of that, September 2019?
She administered all of her testing in September 2019, so I'm not sure which one, except for the CAPS-5, which was 10 days after mine in 2021.
Now, Dr. Hughes clinically evaluated those symptoms and established that Ms. Heard does have PTSD from the totality of the intimate partner violence by Mr. Depp, correct?
That's what she stated, yes.
Okay. Now, Dr. Anderson's clinical notes that said Amber had come to...
Objection, hearsay.
I haven't even asked the question yet, Your Honor.
Are you going to read her notes?
Well, no, actually, I wasn't going to read her notes. I was
Okay.
going to ask a particular question.
Okay.
You talked about danger. Do you recall that in your testimony?
Yes.
All right. Now, if a patient comes to you as a couples therapist with two black eyes, would you assess that there may be a potential danger there?
Sure.
Okay. Did
Of course,
you
yeah.
read Dr. Anderson's notes?
I believe I did.
Now, you administered the Minnesota Multiphasic Personality Inventory 2, the MMPI-2. Do you recall that?
Yes.
And you used that to determine whether Amber had PTSD, right?
Not by itself, but it was a part of the data.
Okay. And in the 60 to 70 T-score range for that test, which, quote, deliberate attempts to mislead are uncommon, end quote. Isn't that correct?
Sorry, could you repeat that?
In the T-score section of that, for which assesses deliberate attempts to mislead, do you recall? She scored a 60 on that test, correct?
So there are multiple T-scores for each scale, so I'm not sure which scale you're talking about.
Okay. Well, we can deal with that later. So you would agree that you need to follow ethics and best practices in forensic psychology, correct?
Yes.
Okay. And the two primary sources are the American Psychological Association Ethical Principles and Professional Code of Conduct, right? Mm-hmm. And the American Psychological Association's Specialty Guidelines for Forensic Psychology, correct?
Yes.
And Specialty Guidelines 1.02 states that forensic practitioners, quote, strive for accuracy, impartiality, fairness, and independence, correct?
Yes.
Okay. And Specialty Guidelines 1.03 states that you have to avoid a conflict of interest, correct?
Yes.
Now, in addition to not listing the 4 hours you spent with Mr. Depp, Mr. Waldman, Mr. Chu, and Ms. Vasquez, you also did not list that you spent an hour with Dr. Shah, correct?
That's incorrect.
You say that the designation said that you spent
During
an
my
hour?
deposition, I also clarified this. I didn't spend an hour with Dr. Shah. There was an introduction with the attorneys present on Zoom. My time on that call was less than 30 minutes.
Okay. But you still didn't disclose it, did you, in your reports?
No.
Okay. Now, you have not been asked to testify about Ms. Heard's behavior in the context of her relationship with Mr. Depp. Is that correct?
I was asked to testify about somebody's behavioral mental status in general, so that can include behavior involved in a relationship with Mr. Depp, but not specifically.
Can you pull up date 10 of the trial testimony at page 2710? Are you able to do that, Michelle? 2710, lines 12 through 18.
May we
I
approach
saved this?
All right. All ready?
Downloads. Okay, attachment saved to downloads. I've been looking for it, but I can't seem to find it. Oh, there it is. Okay. That's what I was supposed to do. It's pretty hilarious how many times Amber Heard's lawyers keep getting contradicted. Like, seriously, what the hell? That's the wrong one. I swear I saved the dang audio to my phone, but I can't find it. It's so stupid.
Okay, does the witness also have
The audio.
Okay. Yep. So, Dr. Curry, this is your
there it
testimony
is.
from
That's
day
what I
10
should've
in
done.
this case. And if you can look at page 2710, line 13. Now, is
I'll
it
play
your,
that
my
when I
question
get a
was, now, is it
chance.
your testimony under oath today that you have not been asked to testify concerning Ms. Heard's behavior in the context of her relationship with Mr. Depp, including any abuse? And your answer under oath to this jury that day was, that's correct.
Yes.
Correct?
I still agree with that to that question.
All right.
Okay.
And you have not made any determinations, including any opinions, that Ms. Heard abused Mr. Depp or Mr. Depp abused Ms. Heard, correct?
Correct.
Okay. And in fact, you said that's outside the scope.
Yes.
Right? Okay.
Of psychology.
And you cannot testify whether Amber Heard suffered any emotional distress as a result of any of the defamatory comments that she has alleged Mr. Waldman made through Mr. Depp, or Mr. Depp made through Mr. Waldman, correct?
Objection, Your Honor.
Do you want me to read my response?
What's
Sure.
the objection? I'm sorry.
What
Hold on,
okay,
Dr.
sorry,
Curry.
Your Honor.
That's okay. What's the objection? Are you on approach? Okay.
Okay. It's pretty hilarious how much Elaine keeps getting contradicted, and like the questions are just some of them are just ridiculous. Oh, but here's that clip I was trying to find. Oh, whoops! I muted my phone so I can't hear anything. That was what my
Now,
wife was whining about
You
earlier
have
when
not
it got
rendered
boring
any
at one day.
opinion as to whether Amber
What's the
Heard
objection? You're on repeat.
exhibits patterns of behavior that would suggest her allegations of abuse against Mr. Depp are false. Would you agree?
No. I mean, yes, I would agree with that.
Thank you. And you have not, no, that's right. That's all I've got. No further questions.
All
Thank
right,
you.
redirect.
Oh, so I got. Oh my gosh.
You were asked about the skid.
Yes.
What's that?
It's a structured clinical interview. It's for rendering a diagnosis. It's best for treatment because you're asking direct questions of the examinee and about symptoms. So if you have an examinee who has a tendency to minimize, you're not going to get much information.
Why didn't you use it?
Because, well, first of all, I had a limited amount of time for my evaluation, and I had already had to use, just to complete the interview was extremely time consuming, and I had to even restructure it into handouts so that I could keep Ms. Heard on
Turn off the
track.
camera whenever I itch.
Determined based on that, so this is where you would make an inference. So because I was having difficulty getting direct answers to my questions from Ms. Heard, I had determined that creating forms of those questions would be a better use of the time, which it was, and then I further deduced that adding on the structured clinical interview would probably be unproductive, given that I had limited time and needed to use the best, most reliable methods for getting information in that time.
You were asked about the APA specialty guidelines,
Yes.
specifically 1.02 and
Yes.
1.03. Have you complied with them?
I have.
No further questions.
Thank you.
Thank you. Dr. Curry, you can have a seat in the
Thank
courtroom.
you,
You're
Your
free to
Honor.
go. Thank you, ma'am.
Okay. It really does seem like she's completely proved that Amber Heard lied about having PTSD, which is honestly really offensive.
Let's go ahead and
to
take
those
our
who
morning
really
recess
have
for
it.
15 minutes. Do not
Like-
discuss the case and do not do any outside research, okay?
Yeah, it's really fucked up that. I mean, the fact that people actually believe what Amber Heard is saying is appalling because she's a flat-out liar. Everything that she's done, she's completely made up. There's no way she has PTSD. Anybody who has PTSD would be a lot more intimidated by the one that's their abuser. It's pretty clear that Johnny Depp is not an abuser.
All right. Just for planning purposes, Sammy asked Mr. Tobin to be here as early as noon, just in case with the fluid of the trial. I'm not sure what time we can get to that motion, so. Okay, just to let you know.
So that would be
They need to work on
9
that.
over
They're gonna find
here
out
if
what
it
the
was
next
noon
witness is.
over there.
So let's go ahead and take a recess until 10:55, okay? All right, thank you.
7:55 over here. Okay, I'm gonna try to get some highlights out as quickly as I can.
I did, and there have been a
Yes. All right, I'll turn off my microphone for now.
Plaintiff calls Shannon Curry, Dr.
No.
Shannon Curry.
That's fine, ma'am, you're still under.
And there have been a rainstorm, and as I left the room, I slid down the stairs, and I hurt my back.
How did you?
And there had been a rainstorm. And as I did, and there had been a rainstorm, and as I left the room, I slid down the stairs, and I hurt my back.
How did you?
And
I apologize, Ms. Moss. Please continue.
and I screamed because I was because I didn't know what had happened to me and I was in pain. And he came running back to help me and carried me to my room and got me medical attention.
Did Mr. Depp push you in any way down the stairs?
No.
During the course of your relationship, did he ever push you down any stairs?
No, he never pushed me, kicked me, or threw me down any stairs.
Ms. Moss, have you ever before today testified in any kind of court proceeding?
No, I have never.
Why did you decide to testify today?
Objection, Your Honor.
All right.
That's beyond the scope of what we just talked about.
All right, I'll sustain the objection.
Thank you, Ms. Moss. We have nothing further at this time. We greatly appreciate your taking the time to testify.
All right, any cross-examination?
No, Your Honor.
All right, you're free to go. Thank you, Ms. Moss.
Thank you very much.
Thank you very much. Thank you.
Person approached the test, moderately elevated one of the skills that can be associated with trauma. So clear indications of exaggeration on one of the measures that specific misrepresented, especially in this context, research or
Misrepresentation of other issues that you intend to address relative to misrepresentation of own results?
Yes, so in addition to using these checklist measures, which are easily exploited in a forensic context, they're developed for research or treatment only. She also stated that these checklists revealed things that they simply cannot reveal, especially in this context. Let's see. She also misrepresented information, clear indications on several of the objective measures that she offered. And there were indications visible that Ms. Heard had essentially engaged in what we call response distortion. So clear indications of exaggeration on one of the measures that's specific to PTSD, clear minimization of symptoms intentional on another more broad personality and psychopathology-based measure that she gave to Ms. Heard, which she did not acknowledge.
Did you intend to address anything relative to the CAPS-5?
I did. So Dr. Hughes administered the CAPS-5 about 10 days after I did, almost 2 years after she initially tested Ms. Heard. So Ms. Heard, which she clear minimization of symptoms intentional on another more broad personality and psychopathology-based measure that she gave to Ms. Heard, which she did not acknowledge.
Did you intend to address anything relative to the CAPS-5?
I did. So Dr. Hughes administered the CAPS-5 about 10 days after I did, almost 2 years after she initially tested Ms. Heard, and she did not administer the test appropriately. So she left major components blank. She didn't apply the scoring rules that are clearly outlined with the test, and yet she diagnosed Ms. Heard with PTSD based
Her hair
on
looks
that
like a
assessment.
cinnamon roll.
What about Dr. Hughes's use of the personality assessment inventory?
So of the tests that Dr. Hughes administered, 2 would be considered, of those 12, 2 would be considered what we call forensically relevant instruments, meaning that they're objective enough and they provide us with some information about how the examinee approached the test, that it would be appropriate for this setting where the examinee is going to have a natural incentive to present themselves in a way that benefits the outcome of their case. Now, on the PAI, there were clear indications that Ms. Heard was responding and obtained scores in a manner that's consistent with individuals who have a personality disorder. And there was also an indication that several scales, we call this a configuration. So you might have one main scale that you notice is elevated, then you look for additional subscale information to get additional information on what could be elevating that scale. And there was a configuration that showed that even though Ms. Heard had moderately elevated one of the scales that can be associated with trauma, that elevation is better explained by childhood or distant traumatic experiences like the complex trauma Ms. Heard reported experiencing growing up.
Okay.
Yeah. She used it as a weapon today.
That Dr. Hughes utilized checklists that are not appropriate for forensic analysis. Can you explain that?
Yes. So, as I said, in any sort of forensic context, whether it's a civil or a criminal matter, a person who's being evaluated is going to have major incentive to present in a way that benefits the outcome of their case. So you always approach the examination, I believe Dr. Hughes said, with a healthy dose of skepticism, but that alone is not enough. We have to operationalize that. So we actually have to administer very comprehensive objective tests that either control for attempts to manipulate the test results or reveal attempts to manipulate the test results, so that we're not just blindly accepting the results or the self-report of the examinee.
How many tests were administered by Dr. Hughes?
She said that she administered 12 tests.
How many of them were appropriate for forensic physical examination?
So the trauma symptom inventory is appropriate. It's an objective measure, and it does have 2 primary scales that look at how the person approached the test. The personality assessment inventory is an excellent test. It is a broadband measure, meaning that it captures not only symptoms of mental illness, but also general personality traits. That also gives us pretty detailed scales similar to that one test I administered, the MMPI, that tell us a lot of nuanced information about the way the person approached the test. She also administered a malingering screen that can be very, very useful, but not in this context. So it's called the Miller Forensic Assessment Symptom Test. It's a brief set of questions that you ask the examinee, and it's been shown by research to be extremely effective at identifying an examinee's attempts to fake a severe mental illness or psychosis. And psychosis is when somebody loses complete connection with reality. It's excellent for that purpose. It's actually been shown in the research to not be effective at all for identifying a respondent's attempts to fake PTSD, anxiety, or mood disorders. The questions are just too odd for somebody who has the wherewithal to be trying to have PTSD to endorse. They see through it. So she used that. That's a fine test, but not appropriate for this context.
Of the various tests that she administered, how many were these checklists?
8 of them.
All right. And what are you talking about specifically?
Okay. So I had mentioned that there were two main categories of checklists she used. The first is the symptom checklists. Those included the Beck Depression Inventory. It's a brief inventory of items that essentially show all of the symptoms of depression that a person might have, and you rate which level of severity you have for each question. She also gave the Beck Anxiety Inventory, very similar, but just with questions about anxiety. She gave the Mood Disorder Questionnaire, which is a very brief, again, checklist. It shows symptoms of bipolar disorder. Bipolar disorder is a mood disorder where you might have an extended manic episode and then a very extended depressive episode. And then she gave the Post-Traumatic Stress Disorder Checklist. And that is a screening instrument only. It contains every single symptom of PTSD. So there's a secondary danger here too. When you think about it, given that PTSD is the most frequently feigned and claimed diagnosis in civil courts, if you're handing somebody a checklist that lists every single symptom of PTSD, you're essentially teaching them all the little nuances that we're looking for to give that diagnosis. So she gave that to Ms. Hurd. Ms. Hurd endorsed most of the items, and Dr. Hughes diagnosed her with PTSD and substantiated that opinion by Ms. Hurd's checking those items on the PCL-5.
Yeah, that's pretty fucked up.
Were there another group of checklists that Dr. Hughes used?
Yes, so she also, and I forgot one on the last because I don't think of it as one, but previously I'd explained, and I do not expect you to remember, it's called the Life Events Checklist, which is just an inventory of experiences a person may have gone through that are traumatic. Dr. Hughes also used that, and that's appropriate to use before the clinician-administered PTSD scale, the gold standard CAPS-5. However, she administered this long ago before she gave the CAPS-5. Now that going on to the second group, there were 3 checklists that she gave that are specific to abuse. And the first she gave, the Danger Assessment Scale, was actually developed for use by nursing staff in an emergency room setting, specifically for female victims.
All right. Are we ready for the jury?
No, Your Honor, we do have an issue we'd like to raise.
Okay, sure.
Ethics, our psychology ethics talk a lot about relevance. Is the test relevant to the purpose? And the Danger Assessment Scale, its initial purpose was completely different. This was developed to show high risk factors for dangerousness and pretty much to help a female who is in an extremely abusive partnership, who is in the emergency room with extreme injuries, to stop rationalizing, because if she has to check off all the things that have happened that year that have been dangerous, does he own a gun, has he, I won't go into all of them, but the more she checks off, the more likely it is that she might realize that she is in imminent danger, and then accept resources offered by the hospital and social work to protect her. That was the purpose of this scale. It was never intended to be used as a retrospective measure to look back in time and find out whether abuse was occurring based on one person's report years later in a litigation. She also gave the Conflict Tactics Scale, revised, the second edition. Similarly, this scale was developed for research purposes, to research family violence. Again, there is no control for exaggeration or minimizing. It was just given to research participants anonymously so that we could get data on the prevalence of abuse and how abusive dynamics work. And on that, there's 39 questions where the respondent indicates essentially certain abusive behaviors they may have engaged in, and then 39 where they indicate behaviors their partner might have engaged in. And obviously, you can understand that in a forensic setting, the respondent is likely to put a very minimal amount of behaviors they engaged in, and then extremely increase the number of behaviors their partner might have. And then lastly, let's see, the Abusive Behaviors Observation Checklist was the third checklist she gave. This one has not, there's no known research even on its effectiveness for what it was developed. It's a theoretical, very brief checklist that was meant to be used for therapy, where an individual who had experienced domestic violence could essentially read through some of the behaviors that constitute violence that they might not have been aware of. And if those behaviors applied to them, or if some of those coping strategies were ones they utilized, they would check that off, and then they have a way to talk about it because now it's been put to words. Again, this is similarly problematic if you're in a civil litigation, the person's motivated to have their results be consistent with a claim or an allegation of intimate partner violence and an allegation that they've been severely harmed, then they could simply just check off more. And not only that, but checklists like this one specifically give a lot of nuanced information about what clinicians might be looking for when they're assessing whether violence was present or whether the person's self-report is consistent with a genuine self-report of having been victimized. They're given all that information that we might be looking for.
Can you talk specifically about Dr. Hughes' use of the, I think you called it the PCL-5?
Yes. So the PCL-5 is the post-traumatic stress disorder checklist. This is different, not to be confused with the CAPS-5, which I've talked about previously as being the gold standard. The PCL-5 was developed by the National Center of PTSD. It's intended for treatment. So if I were, for instance, working with a service member who I know had been in combat, I would probably give this as a standard with my intake. Before we do the diagnostic interview, it kind of gives me a read on how somebody who's there for treatment, who we assume can be taken at their word because if they give us correct information, they're going to get an appropriate treatment. And if they give us incorrect, they might not get the treatment they need. So I would give this checklist to them, and then if they recognize some of those symptoms of PTSD, they could check it off. And that would probably indicate to me that I need to then do the next step. If they're checking off more items than not, I would probably decide to administer the clinician-administered PTSD scale, that gold standard interview, to find out more about a diagnosis.
The last thing is what everybody refers to as the CAPS-5?
Yes, the CAPS-5.
All right. What about, well, you talked about forensic use. What do you mean by that?
So when I'm talking about forensic evaluation, that's an evaluation that isn't done for therapy or treatment. It's specifically to assist the fact finder, to assist the judge or the jury in the court by providing information about the psychological status about an individual. And that's an important delineation too. We are not psychologists. I wish we were mind readers. I wish we had a crystal ball and could find out whether intimate partner violence occurred and look back in the past. But it's nothing like that. Really, it's a lot less interesting. We look at data. We have to control for those response biases. And then we also are looking at functioning, which is really the bottom line of the assessment. Did the person have a change in functioning from before the alleged trauma, or in this case, the alleged IPV, to after? Is there a decline in the way they're going about their lives?
And Your Honor, may we approach?
All right.
Okay, looks like they're put makeup in my eye, or not. Oh yeah. Just gonna check and see if it works.
Odd for somebody who has the wherewithal.
All right.
Let's
well,
look back at problem with the use of those.
Yes.
What problems did you see?
Well, Doctor, the CAPS-5, which I've talked about, is working, and that would be CAPS-5. When I'm judge or psychologist, it's a lot. There a decline in the way they're going about their lives.
And Your Honor, may we approach?
All right.
standards that were, yes.
Those domestic violence.
The associated with
Dr.
trauma.
Curry,
That
All right.
let's
well, I'll have
look
to switch
back
it back
at
to later.
had moderately elevated one of the skills that can be associated with
Dr.
trauma.
Curry.
That
All right.
Let's
well, I'll have
look
to switch
back
it back
at,
to later. But it's cool. I can do
some
that.
of those domestic violence checklists that you were talking about.
okay.
And
They shouldn't be used. So we do have professional
Okay.
standards that require that we utilize instruments that are relevant and appropriate for the particular setting, and that we substantiate our opinions based on data that is reliable from tested appropriate. Doctor, first of all, they shouldn't be used. So we do have professional
Okay.
standards that require that we utilize instruments that are relevant and appropriate for the particular setting, and that we substantiate our opinions based on data that is reliable from tested, accurate, reliable tests for the purpose. So there's that. It's inconsistent with the ethics. And essentially, they just shouldn't be used. They don't provide us with the robust information that it would be expected in such a high-stakes setting.
would you have expected Dr. Hughes?
Dr. Hughes, in a very dangerous situation about the reliable data, information about, but we would first need to potential is really
Distortion. What?
of good science in general.
You talked a little bit about ignoring response distortion. What is response distortion?
Response distortion is a term that speaks generally about an examinee approaching a test and providing answers that are either exaggerated or minimized, but in some way an inaccurate representation of their current mental status or their experience.
What test do you believe that Dr. Hughes failed to acknowledge response distortion on?
So she administered the personality assessment inventory, which is similar to the test I gave, the MMPI-2. It's that general broadband measure of psychopathology symptoms and personality traits. It includes several scales that are very good at detecting either exaggeration, minimization, or even trying to claim that you have unusually good qualities. On that test, there were clear indicators that you have that main well-being of one of these configurations. Accidental, an intentional
To malingering?
questions on the test. So, for instance, the personality on those, mental illness or personality ease of explanation when finding out if a person is proved this time around to that are so unusual, PTSD or possibly unintentionally, but nonetheless, who's exaggerating it, is likely to endorse these items, even though they're not real PTSD symptoms. Ms. Hurd scored so highly on this that even if there is, although Dr. Hughes correctly said, there tends to be a negative skew when people have the high levels of distress that's associated with PTSD, so sometimes people score higher on this even when they do have PTSD. She scored so high that that is effectively ruled out as a possibility.
Okay.
What about...
She scored so high that that is effectively ruled out as a possibility.
Okay.
Most Ms. Hurd, we started the CAPS 5 with Ms. Hurd, using what we consider to be the professional standards are that we document everything, very relevant, no text, and if you don't fall to question, period.
Mentioned what she failed
She also failed time personality, just one of the diagnostic tests, but chronic abuse.
with her own testing.
She was that she said that, but they were elevated. This isn't on this test. The litigants far beyond to the level that it is, you automatically understand that it is very likely you see on a lower adjustment. The oversight now very similar, or probabilistic of certain behavior. A lot of denial about one's own personal faults.
Okay, yeah, that sounds like her.
All right, your next witness. I'm sorry, let's get the jury first, right? All right, you ready for the jury? Yes, sir. All right, thank you. Are we ready for the next witness? Or do you
Yes,
want
we
to
call Mr. Depp.
Okay.
Mr. Depp, all right, awesome. Let's see Johnny Depp.
All right. So just a reminder, you're still under oath, okay?
Yes, ma'am.
All right, thank you, sir.
My wife
Good morning,
would
Mr.
leave
Depp.
My wife would leave me for Johnny Depp.
We heard a lot about some statements that Mr. Waldman made. Do you remember that?
Yes.
And Mr. Waldman is your attorney or was your attorney?
Yes.
Could we please pull up Defendants Exhibit 1245? And this is already in evidence, so permission to please publish. If we could scroll down to the second page. Mr. Depp, do you see the statement here attributed to Mr. Waldman?
Yes, I do.
When's the first time that you saw this
So
statement?
smug. With that cinnamon roll hair.
All right.
that it was far beyond you automatically understand sort of these peaks you see on a graph, lowered or suppressed based on the respondent being so defensive. They still did or above. We called it a T-score of 60, and that was how I got that. I had mentioned a 3-6 code type, which is very similar.
What is a 3-6 code?
Tendencies and personality, its own personal faults.
We can pull the exhibit back up. Thank you.
Okay.
Mr. Depp, when is the first time that you saw this statement by Mr. Waldman?
The first time that I ever saw this statement was in August. It was when the piece was Wait,
what happened?
This is the first time that I saw any of these statements.
That's
Can we
weird.
please pull up Defendants Exhibit 1246?
Somebody messed up on the broadcast.
This is also already in evidence. Thank you. If we could scroll down to the second page, or the third perhaps. Thank you. Mr. Depp, do you see this statement that's attributed to Mr. Waldman here?
I do.
And when is the first time that you saw these statements?
Same, when the countersuit was filed.
And could we please go to Defendants Exhibit 1247? And again, this is already in evidence. And if we could scroll down, please. Thank you. Mr. Depp, do you see the statement attributed to Mr. Waldman?
I did, yes.
And when's the first time that you saw this statement?
This is the same. It's the counterclaim to August 2020.
After you saw these statements for the first time, did you form an understanding as to where they appeared?
I didn't, as to where they had appeared, these statements.
In what publication?
No, off the bat, I didn't know exactly. It just seemed like a lot of word salad to me. I didn't know where they'd come from, or where they ended up. Or
Mr. Depp, do you recall Ms. Heard testifying that you did not assist her in getting her role in Aquaman?
Yes, I do, yes.
And what is your response to that?
Jeez,
it's not exactly true.
Do you know when Ms. Heard first auditioned for Aquaman?
Strangely, I know the date. Yes, I do know the date, because I was scheduled with my band, the Hollywood Vampires.
That's awesome.
We had done 2 shows at the Roxy, which is a place in Los Angeles, to
here in Santa Rosa, we had Roxy
rehearse
Theater.
for we were invited to play at the Rock and Rio concert, which is a huge rock and roll festival. So we did the 2 shows to go to Rio and play there. Miss Heard wanted to come with me, and Whitney, her sister, had come as well. While we were there in Rio, we were rehearsing, getting ready for the show. Miss Heard informed me that she would have to get back to Los Angeles for an audition, meaning it's basically after our 2-hour show or whatever, we would have to get on the plane immediately to make it back to Los Angeles for this audition. And that audition was at Warner Brothers. It was whatever film it was.
And when were you performing at the Rock in Rio?
Oh, sorry. Yeah, that was I believe it was the 24th of September.
In what year?
That was 15.
What do you understand happened after Ms. Heard auditioned for Aquaman?
After Ms. Heard's audition, or possibly auditions, for Warner Brothers and I suppose the creative team, Ms. Heard had expressed to me that the film was going to be, Warner Brothers had said that the film was going to be shooting in Australia. And Australia was for Ms. Heard, that was a potential problem, which...
Objection, Your Honor. Your approach?
Okay.
Okay, yeah, that sounds like her.
Intentional or not intentional. Family members, those quote types, which tends to be associated with cruel.
Review process that you did, that you went.
I do this for every test, and I also just up her scores, and I start with looking at all the low, and then if it's low, is it a particular scale score? Sense of well-being, really saying that she feels free of distress associated with that, and the research scores. Then with all of it for Ms. Heard, I can't associated with it, but it looked at the scores that were. And the reason for that is
You believe
Dr. Hughes generally said that testing supported PTSD, and
my wife's saying she'd leave me for Johnny Depp. I'd leave her for the Judge Penny.
that there was. She said that the trauma that scale with PTSD stress. I don't know what she's endorsed to detect, yes, on that atypical response scale. 98% of people who have ever rating
self-reports and personal opinion as facts. What are you talking about there?
So in any science and in psychology specifically, it's really important that we use precise language and we say what we mean, and we do not in any setting. Essentially, a layperson may not be able to detect the difference between something that is a personal opinion that you're about, especially the special data, what the data can mean. So it's very important that we clarify that to the fact-finding expert fact or somehow science. My ultimate opinion is integrate both personal or self-report of an examinee.
When did Dr. Hughes do this mode?
Of our ethics also private information, what was Ms. Heard's report to her, the allegations of abuse when describing Mr. Depp, who she had not examined, simply things that we only describe initial, shocking, and hard to forget.
Was
My
a court case in
multi-method
regards to the
comprehensive
Ukraine war,
evaluation
somebody
based on observing Ms. Heard's behavior, reviewing the notes, providers,
this bad wolf, but yesterday
How is evidence of PTSD
evaluation
decided not
is
to.
I apologize, Mr. Depp. Could you please continue? What happened after Ms. Heard auditioned for Aquaman?
I was informed by Ms. Heard that the film was going to be shooting in Australia, and that was of concern to her, and because it was of concern to Warner Brothers. So she asked if I would, because I'd had a multi, for a few years I'd had a multi-film deal with Warner Brothers, and so we'd been in business together. So I knew these people. I'd been on films with them. So she asked me if I would speak to them. I made a phone call and I spoke to...
Objection, hearsay, Your Honor.
I don't believe he said anything. I think he was going to say who he spoke to.
All right, we'll see. Overruled at this point.
I spoke to the three upper echelon Warner executives, Kevin Tsujihara, Sue Kroll, and Greg Silverstein. And I told them that...
Objection, Your Honor. Hearsay.
All right, I'll sustain the objection. Next question.
What was the result of you speaking with those individuals?
Well, I can only say that ultimately she did get the job in the film. So hopefully I suppose I had curbed their worries to some degree.
Mr. Depp, do you recall Ms. Heard testifying that she saw you consume 8 to 10 Mdma pills while you were in Australia in March of 2015?
Yes, I do remember that.
How many?
I also remember her saying that I took a handful.
Objection beyond the scope. Question.
Sorry, that was extra residue.
All right, I'll sustain the objection. Next question.
How many times have you done MDMA in your life, Mr. Depp?
Actually, not that many times. I would say in my lifetime, MDMA 6, 7, maybe.
And how much MDMA have you done on those occasions?
Not enough to properly. Well, not enough to properly experience what the chemicals are supposed to do to you.
Have you ever consumed 8 to 10 MDMA pills at once?
No, ma'am. No, I have not.
And why is that?
Because I'd be dead. I'm pretty sure I'd be dead. I think one would die. Yes, and probably rather quickly.
Damn.
Mr. Depp, I'd like to show you some pictures from the home in Australia that Ms. Heard testified about.
Sure.
Could we please pull up Defendants Exhibit 1817, which is already in evidence? Mr. Depp, do you recognize what's depicted in this photograph?
Yes, I do. That's the downstairs bar of the house we rented in Australia.
And can you please show the jury where you were sitting when Ms. Heard threw the 2 vodka bottles at you?
If I touch this thing, it'll make a
Yes,
mark.
it will.
Yes. Okay.
Okay, cool.
So this chair, that one here, was over here. And it was in pretty much when I was
God, quit smirking.
turned around toward, they were on a swivel, so when I was turned around towards the bar, I'm facing the bar. When I turned around this way, this chair here was in
always smirking.
pretty much exactly this same position as this chair. It was when I was facing Miss Heard, who was, let's say she was, if you're looking at the photograph, she would be about here.
Could you draw a line in the direction where Ms. Heard was relative to where you were sitting?
Yes, absolutely. So if I'm sitting here, she was over here. Like back here.
Just respond to my wife right there.
Approximately how far away from Ms. Heard, from you was Ms. Heard, if you can recall?
Your goddamn cinnamon roll hair.
I would
You're
say
smirking and
I
your
would say
conceited
it was
expression. Go fuck
probably
yourself.
10, 12, 15 feet maybe.
Team Johnny.
10 feet, 12 feet.
And approximately where was your hand when the vodka bottle hit it?
It was leaning. My arm was leaning on the marble bar, right there where that the imaginary seat is, and leaning, kind of just leaning back and looking at Miss Heard. She just walked away with the second bottle. I mean, she walked this way when she threw the first bottle, which is actually visible
Can
in
you
the
please circle
background
where
on the
the
floor.
first? Yeah. Could you please circle where the first bottle
Oh,
is?
sorry, excuse me. Yeah.
Quit smirking.
All that is the exploded first bottle that went past my head, and the second bottle
Oh, here we go.
hit right up here where my hand was resting on the marble bar.
Can we please pull up Defendants Exhibit
Shut up,
1820? Mr. Depp, do you recognize what's depicted in this photograph?
This is behind that very bar.
And what do you see on the floor in this picture?
I see what looks to me like some kind of napkin. It looks sullied, soiled, blood, I don't know. And I see glass in the corner, blood obviously on the floor, and a towel leaning up on something.
Do you know how that bloody tissue got on the floor?
My best guess.
Objection calls for speculation.
Sustained.
Do you know how the blood got on the floor, Mr. Depp?
I'm pretty well. I know how the blood got on the floor. It came from my dripping finger, so that's why the tissue is. I'm 99.9% sure, since it is. Looks like it's got blood on it as well. Is what I held my finger with.
Do you see the wall on the left side of the photograph?
I do.
Was there a wall-mounted phone on that wall?
On the left side of the photo. No, I didn't. No. Not that I recall. No.
Could we please pull up Defendants Exhibit 394, which is already in evidence?
Yes, ma'am.
How do you guys remember all these numbers?
Mr. Depp, do you recognize this text message?
I do.
And what is this message?
It's a text to Dr. Kipper.
Okay.
I'm sorry, just reading through.
Sure.
Yeah, this is my text to Dr. Kipper, who had just happened to be in town, telling him that I've had it, and that I just lost a fingertip.
How long after your finger had been injured did you send this text message, if you can recall?
It's hard to tell, because when I look at the timestamp, it says delivered 3/7/2015, 5 o'clock. But I know that because of Australia time, it was the 8th, and it was probably, the whole thing lasted probably until about 2 p.m. Or so, when that was when Kipper was called, Jerry was brought in. Judge, sorry, excuse me.
So do you have an estimate as to how long after your finger had actually been injured that you sent this message?
I don't think it was very long. I think it was probably within the next, I'm sure it was within the next half hour or so. I would have had to sneak into a bathroom, lock myself in to type this out.
And how were you able to send this text message to Dr. Kipper in the state that you were in?
Well, he wasn't available at the time, so just sort of thumb your way through, don't you?
How long after sending this text message did you see Dr. Kipper?
I don't recall, but I think it took them probably 30 minutes or more, 30 to 40 minutes to get there.
And what did Dr. Kipper do when he first arrived at the home?
Oh, the first thing he wanted to do was inspect the damage of my finger and try and figure out exactly what had happened, how it happened.
And what did you tell Dr. Kipper about how your finger had been injured?
Objection, Your Honor.
May we approach?
Hearsay. We've discussed this several times.
Let's go.
We discussed this several times. They're trying their best to make him look bad, and they keep screwing up because they have nothing. Amber Heard's a liar.
A change in functioning. That's what we're looking at. The way the PTSD, it is there's before they become clear. Usually, they're not exercise. Those are.
All right.
And when you're looking for a decrease in functioning over time, that is inconsistent with that decrease.
What about Dr. Hughes' suggestion that Mr. Waldman's statements...
Okay, it looks like they're doing an approach right now.
All right.
Suggestion that Mr. Waldman's statements served as a trigger for Ms. Heard's PTSD.
All right.
Reminds me, the talking about lawyer cannot get. I was like, there you go.
Cross-examination.
Now, Hughes had suggested that...
I saved it somewhere on my phone. I was going to play it right here on the stream.
Dr. Hughes had suggested that perhaps...
I was going to play it right here on the stream.
Dr. Hughes had suggested that...
I saved it somewhere on my phone. I was going to play it right here on the stream.
Dr. Hughes had suggested...
I would say that...
Remember, you're not board certified, correct?
No, I'm not.
Where is it?
Dr. Curry, I just want to make sure that we all remember, you're
Mr. Depp, when Dr. Kipper was treating your finger, what did you tell him about how your finger became injured?
I told him that there was obviously, when you saw the damage in the house and everything, and the blood everywhere, obviously there was serious damage done. There would be no point in lying to the man. He'd been through it with me and Ms. Heard before. I told him that she had thrown a bottle of vodka and smashed and cut my finger off, the tip of my finger, but a good chunk. I miss it.
Mr. Depp, you heard Ms. Heard testify about an alleged incident of abuse on your honeymoon. Do you remember that?
I remember her testifying to that, yes.
And when did you and Ms. Heard go on your honeymoon together?
I believe it was somewhere in the neighborhood of August, because I just finished the film. Maybe end of July, August. I'm not quite good on the exact date.
Do you recall the year?
It was 2015, I believe.
And where did you and Miss Heard go on your honeymoon?
We took the Orient Express from Bangkok, Thailand to Singapore.
And what happened while you and Miss Heard were together on the Orient Express? There were times when it was very agreeable, very nice. And then there were times when something had become dissatisfactory for her, and she would start the rant, the blooming of a fight would be on deck there, and at one point it didn't. I mean, I don't remember it lasting long at all. I just remember that I took a pretty good shot to the face, to the eye, to somewhere up here. So I had a bit of a shiner. But it all ended, and then everything got fine again, and we'd go to dinner, and it was all fine. Did Miss Heard ever apologize to you for giving you the shiner?
I don't recall.
I doubt she did.
Can we please pull up Plaintiff's Exhibit 162,
Sociopath.
which is already in evidence?
Amber Heard is a sociopath. No empathy for others at all.
Mr. Depp, do you recognize this photograph?
I do. It was with the chef and the maitre d' and the staff were asking if they could take a photo with us, and they'd been very kind. They'd given us a private dinner card.
So where was this photograph taken?
That was in the, that looks like it's in the, yes, that's towards the back of the Orient Express. That's in the back train bar compartment. And just out back, you could smoke on the sort of caboose or whatever.
And what, if any, injuries do you have in this photograph?
I think the eye's a little bit bugged out, if you will. It's, yeah.
How did that happen?
These things could happen very quickly if you disagreed.
Objection, Your Honor, non-responsive. She just asked, how did that happen?
I believe he was about to explain.
Well, I'll sustain the objection.
Okay. So, Mr. Depp, specifically, how did the injury in this photograph occur?
I'm sure it hit me. Is that better?
Does this picture accurately reflect what you looked like on that date?
I don't look at myself much, but it certainly looks like me with a black eye. Yeah.
Does this picture appear to have been photoshopped in any way?
No, I think no. I think it would be difficult to photograph or to start getting into sort of digital processing with a number of people in the shot, especially in a wide shot.
Could we please pull up Plaintiff's Exhibit 1301, and this is a new one, Your Honor, so this is not in evidence.
Okay, thank you.
Mr. Depp, do you recognize what's reflected in this photograph?
Yes, this is the staff, it's the manager and his staff at the Raffles Hotel in Singapore. And before we left, they asked if they could take a photograph with us.
And when was this photograph taken?
Well, that would have been, we were off the Orient Express. We stayed in Raffles, I believe, a couple of few days. And then from there we flew to San Francisco.
So this photograph was taken after the photograph we just looked at?
This photograph was taken after the photograph in the dining car of the train, yes.
Your Honor, I'd move Plaintiff's Exhibit 1301 into evidence.
Pardon, any objection?
Oh, happy honeymoon. So it's
Any
31st of October.
any objection?
On Halloween, how?
No objection, Your Honor.
All right, 1301 is in evidence, can be published to the jury.
Mr. Depp, what, if any, injuries do you see on your face in this photograph?
I see pretty much the same. I see that the area in here has been is swollen and yeah, there's a bit of a shiner there.
Thank you. We can take this down.
God, look how
Mr.
proud
Depp, do you
Amber Heard
recall
is of
Ms. Heard
this.
testifying that she punched you in the staircase incident because she thought of Kate Moss in the stairs?
Do I remember her saying that?
Yes.
Yes, I do. 3 times. Yes, I do.
Do you have any understanding as to what Ms. Heard was referring to?
Yes, I do.
And
as Kate Moss, Kate testified.
That was directed at
It was many,
Heard,
many
but
years
she's
ago.
not watching.
And exactly what happened is what she said happened.
Kate Moss defended Johnny Depp. Amber Heard's a liar.
recall speaking with Ms. Heard about that very incident because of the downpouring of rain, because it was raining very heavily that day that Kate slipped. And I recalled the story to her.
Objection, Your Honor. Hearsay.
May we approach Your Honor?
Okay.
I need to get these highlights out. Kind of having difficulty with them now. Okay, trash that one. I probably will try to make clips out of each highlight because these highlights are incredibly long. Okay.
Please continue, Mr. Depp. What did you tell Ms. Heard about the staircase, or Kate Moss?
I'll make it easy for Mr. Rottenborn. Ms. Heard took the story and turned it into a very ugly incident, all in her mind.
Of course.
There was never a moment where I pushed Kate down any set of stairs, yet she's spewed this 3 times before.
Objection, Your Honor. Ms. Heard simply testified that she had heard a rumor, and that's
What's a rumor?
non-responsive to the question.
Sir, hold on. This
Sorry.
objection. I'll overrule the objection.
Misstates the facts and evidence.
I'll overrule the objection.
Sorry, I was drawn by Mr. Rottenborn's voice. What would you like? What was it?
So what specifically had you actually told Ms. Hurd about the incident with Miss Moss and the stairs?
Very simply that we were in Jamaica. I had left our bungalow about 3 minutes prior to her. I was standing outside and suddenly rain starts just coming down like it's, monsoon. And then I remember looking and seeing Kate coming out the door, and there were 3 little wooden stairs, and she slipped, her legs went up, and she landed directly on her coccyx and her lower back. So, and she was obviously physically in pain, and she was hurt, she was crying. So I ran over and grabbed her to make sure she was all right. That's it. That's all I ever. That's the whole story. But then the rumor of it, I'd never heard a rumor of that before Miss Hurd grabbed hold of it. It's like that. I'm sorry.
Mr. Depp, we heard testimony from Miss Hurd's sister, Whitney, during this trial. Do you remember that?
Yes.
Yeah, who lied for her.
And how would you describe your relationship with Whitney when you were in a relationship with Miss Hurd?
I liked Whitney very much. Initially, when I first met her, I liked her very much, and grew to love Whitney very much, because I always, it seemed, Whitney, Amber's sister, Whitney, seemed to always get the sort of dirty end of the stick, and I felt bad for her for that, because it wasn't new. It had been there for life, and that was seemed pretty obvious. So I took to Whitney very, very quickly, very easily. She was a very sweet kid. She was wonderful.
What do you mean that Whitney got the dirty end of the stick?
It was a kind of a strange combination of loving sister, trusted sister and friend,
Amber Heard keeps folding that lackey. It's so stupid.
And then, either the punching bag or the dartboard, or the recipient of some rather demeaning and ugly words, or she would have wine thrown in her face.
That's horrible.
And who was the source of those demeaning words and the wine that you just referenced?
Well, that would be Amber Heard, her sister.
Yeah. Whitney is scared of Amber.
How do you know that?
And look how proud Amber is of it.
Well, I witnessed quite a lot of it. The wine in the face was something that happened in New York.
Jeez, enough
which
with her stupid facial expressions, Amber Heard. God, she's like so proud that she terrorizes her own sister.
I believe that even made it into the papers. It was in an elevator.
How did you first learn about that incident?
Miss Hurd told me in detail.
What else did you observe of Miss Hurd and her sister Whitney's interactions during your relationship with Miss Hurd?
They were just constantly up and down, but I could sense, I could feel that Whitney was trying to please her sister, trying to be up to snuff. And
Amber just abuses her for it.
It just seemed like she got shot down.
Objection, Your Honor. This has gone beyond the scope of the question or his foundation for knowledge of that.
Your Honor, I asked what he observed, between them. I think this is responsive to that.
And his testimony as to what Whitney felt is.
I'll sustain the objection. Next question.
Okay. Did you ever see Miss Heard physically attack Whitney?
No, I've never seen any full-on blowouts, physical blowouts between them.
Well, that's what abusers do. They try to do it behind closed doors.
Objection beyond the scope.
Overruled.
I've certainly seen Miss Heard grab Whitney, push her around. There were a number. There were half a dozen times when some of us, whoever was in the general vicinity, would have to leave. This is at Orange, when Whitney and Amber were living at Orange. Whitney and her boyfriend at the time, Sean Krajewski, and we had to leave the apartment and wait in the car while they fought.
And when you say fought, do you mean physically or?
Physical.
And when you said Miss Heard would push Whitney around, do you mean that to physically push her or metaphorically?
Both.
Oh yeah, I knew it.
You heard Whitney testify that she lived in Penthouse 4 at the Eastern Columbia building for a time, correct?
That is correct, yes.
How did Whitney come to live in Penthouse 4?
My recollection when Whitney first came to stay at the Eastern Columbia building in Penthouse 4 was she and her boyfriend, Sean, had broken up. And she needed a place to go. And so Amber asked if she could stay in Penthouse 4, and I said, well, of course, you know.
How long did Whitney live in Penthouse 4?
It was well over a year, on and off.
Did you ever ask Whitney to move out of Penthouse 4?
No, I did not, no.
Okay.
Why did Whitney ultimately move out of Penthouse 4?
Objection, foundation.
It's his apartment, Your Honor. He was living there.
Oh, overruled.
Overruled.
Whitney moved out of Penthouse 4 long before the marriage, and it was due to an argument that Ms. Heard and Whitney had, which had to do with Whitney working at the Art of Elysium with Jennifer Howell and those people.
Okay.
And Amber asked her to leave, get out.
Where did Whitney live when she moved out of Penthouse 4?
My understanding is she went to live with Jennifer Howell.
Your Honor, I know you anticipated having a motion at noon.
You can keep going. That's
okay.
fine. We can. How much longer in direct do you have?
I have a bit.
Okay, that's okay.
Mr. Depp, do you recall hearing testimony during Ms. Heard's case from Mr. Mandel?
Yes, I do.
And who is that?
Mr. Mandel is my former business manager of 17 and a half years, who at a certain point I discovered had been embezzling quite a lot of money. So I had to take action against him and he and my lawyer of 17 and a half years, as they were in cahoots, as it were. And so yes, Joel Mandel is, and they settled their case with me. They made their settlement. But yes, it was the big. That was a very Joel Mandel is a very bitter man who ended up with a lot of money that I worked hard for over the years.
Do you recall Mr. Mandel testifying in this case that you do not spend very much money on charity?
That I don't, sorry?
That you do not spend very much money on charity.
Objection, Your Honor.
You just want to approach? Okay.
Let me get these out there now. They're really long, so I'm probably not going to upload them. But I don't know, maybe I'll just post them anyway.
Mr. Depp, just to remind you, my question was, what is your response to Mr. Mandel's testimony that you do not spend very much on charity?
My response to that is Mr. Mandel is a very bitter man, and one thing about that me, myself personally, with regard to charity donations, sending money to a charity, I prefer.
Sorry, bad time.
I don't. I would rather that my name were not on it. I don't want the name to be the important thing or the thing that people talk about. Oh my God. So when I donate money, I donate without my name being involved because I don't see that that's important, my name being there in terms of money. Now,
yeah, that's actually really.
If I am
like
able
that.
to visit hospitals, or if I'm able to,
like you did as Captain Jack Sparrow,
meet with Make-A-Wish children.
There we go, Make-A-Wish children.
I have held on to the relationships that I've held on to within the Make-A-Wish Foundation and the Children's Hospital and various other places. Then obviously my name is involved. When we held premieres in Leicester Square for several films, Charlie and the
Objection, Your Honor.
Chocolate Factory.
Again, beyond the scope of his response to Mr. Mandel's testimony.
I believe this is in response to Mr. Mandel.
I'll overrule the objection.
So basically, when it was a public, let's call it donation or whatever, I would talk to the studio, I would talk to Disney, I would talk to Warner Brothers, I would talk to whoever the studio was, well before the premiere, and make the premiere a benefit that would, once we did what we benefited, we did a benefit premiere for Great Ormond Street Hospital. We did a couple of benefit premieres for the Make-A-Wish Foundation. I mean, if you can turn a premiere with that many thousands and thousands and thousands of people there into a benefit, it works and it helps. but it wasn't presented under my name. You know, it was Disney's doing this or Warner Brothers is doing this. I'm not looking for the pat on the back, as it were. If I can make it happen, great. But I don't need the pat on the back. I don't need the adulation. I don't need the attention.
Did you hear Ms. Heard testify that one of the charities she donated a portion of your divorce settlement
Which she
to
didn't.
was the Children's Hospital of Los Angeles?
Yes.
What is your relationship with the CHLA?
Objection, Your Honor. Irrelevant and to the
May
issue
we
just
approach, Your Honor?
discussed.
I want to download the file, but it's just bad timing. I was going to rename it, but there's not enough time. I should do it later when there's not. When the lunch break is happening. Maybe I did have enough time to do it. In some ways, I feel sorry for Whitney. She's always being abused by her sister. She's terrified of her, which is why she's lying for her. But at the same time, she's in a court of law. She could have told the truth. Yeah, I mean, it's a lawsuit, so only money would be lost. No jail time, but who knows, maybe a perjury case will be made against Amber Heard for the fact that she has been lying on the stand the whole entire time. It's ridiculous. And another thing is, like, Johnny Depp is responding like a normal person would. Amber Heard really seems rehearsed, not to mention she's always trying to turn her head to look at the jury every time, and it's like, stop doing that. That's all that Amber Heard does, is she tries to do intimidation tactics and tries to be convincing instead of actually, because she's lying. Johnny Depp doesn't need to do that because he's telling the truth. And that cinnamon roll hair is ridiculous.
Mr. Depp, what is your relationship with the CHLA?
I've had a relationship with the CHLA for probably 20 years or so.
And
Stop
what's
with your
the nature of that
smirking.
relationship?
Damn it, Amber, stop your smirking.
Well, since you know, sometimes there are Make-A-Wish kids who are in the hospital there, and that their wish is to.
Objection, Your Honor.
Your Honor, may we approach?
Damn it, stop it.
Mr. Depp, I'd like to take you back to exactly 6 years prior to this week, the week of May 21st through May 27th, 2016. What happened at the beginning of that week?
May 21st.
Excuse me, May 20th.
Okay.
May 20th. We're talking 2016 here.
Yes.
Okay. Her hair looks like a
20th,
worm.
the afternoon of May 20th.
Sorry, my wife said something hilarious.
Afternoon, evening. My mom made her exit. She'd been fighting cancer numerous times and for many years, and she fought all the way to the end. And so my mother passed away on the 20th of May. Which does bring instant perspective into one's mind. I spoke to Amber that night. I called her on the telephone, explained to her that my mom had passed, Betty Sue had passed, and that I thought that the best thing we could do was to that I filed for
Your Honor,
divorce.
hearsay. What Mr. Depp told Ms. Heard.
We can move on, Your
Okay,
Honor.
yes, ma'am.
Mr. Depp, what happened at the end of that week on May 27th, 2016?
May 27th, my daughter's birthday. May
Like an earworm
27th.
on her damn hair.
I was not in Los Angeles. I was on the way to on tour, and that was when Miss Heard went for the restraining order. And oh yeah, also that was the day that Alice Through the Looking Glass, a film I'd done, was opening.
Okay.
Did Ms. Heard know that you were out of town on May 27th?
2016, yeah. Good.
Yes.
And how would she have known that?
Well, I told her I was going on tour. I mean, that was well established.
Okay.
How long were you going to be out of town on that tour?
2 to 3 months.
And did Ms. Heard know how long you'd be out of town?
I don't know if she knew exactly how long I'd be out of town, but it was a pretty extensive tour of Europe.
How did Ms. Heard's actions on May 27th, 2016 affect you?
Changed everything.
Objection, Your Honor. Relevance.
Oh, it didn't change
to
everything?
This lawsuit.
Sorry.
Sure, if you could wait till the objection, please.
Yes, I'm sorry.
Relevance.
Tourette's.
Your Honor, this is one of the key
If you want to
dates.
approach.
Oh my God. Amber's team is really testing my patience, honestly. I mean, what kind of objection was that? He said it changed everything. That's objectionable? What? I'm not like a master at law and stuff, but this is getting kind of ridiculous. Holy crap, that's a huge amount of money that person donated. Not like they needed that much. Oh wait, no, I wasn't meaning to go here. I should be going to Google Drive. All right. This is annoying. There they are. Boom. I'm going to use those for later. Now I can download to my phone. Okay, I didn't realize I was playing, had volume on. Let's see here. Go to my Google Drive while this is happening. Guess I could have downloaded those videos. They're coming back though, I can't do that now.
Mr. Depp, what has it been like for you to listen to Ms. Heard's testimony at this trial?
I'm sorry?
What has it been like for you to listen to Ms. Heard's testimony at this trial?
Objection relevance, Your Honor.
You guys were just up there. Jeez.
Insane.
Of course.
It's insane to hear heinous accusations of violence, sexual violence, that she's attributed to me, that she's accused me of.
Not to mention doesn't have any proof of.
I don't think anyone enjoys having to split themselves open and tell the truth. But there are times when one just simply has to, because it's gotten out of control. Horrible. Ridiculous, humiliating, ludicrous, painful.
Yeah, I bet.
Savage. Unimaginably brutal, cruel, and all false.
Yeah,
Awful.
exactly. All false. No proof.
I wanted no human being is perfect, certainly not.
Obviously. Yeah.
None of us. But I have never in my life committed sexual battery, physical abuse, all these outlandish, outrageous stories of me committing these things. And living with it for 6 years.
Yeah, that's horrible. God, it must have sucked.
And waiting to be able to bring the truth out. So this is not easy for any of us.
Obviously.
I know that. But no matter what happens, I did get here, and I did tell the truth, and I have spoken up for what I've been carrying on my back reluctantly for 6 years.
Yeah, I bet. Oof.
Thank you. No further questions.
All right. Did you want to take lunch at this point, or just, okay, all right, let's do that. All right, ladies and gentlemen, let's go ahead and take lunch at this time. Do not discuss this case with anybody, and don't do any outside research, okay? Thank you.
Okay, so while I do that, I'm going to take care of...
And don't break anything on your way out. Thank you.
Don't break anything on the way out? What? Did that at what point happen?
All right. So just a reminder that since you are back on the stand, do not discuss this case with anybody to include your attorneys at this point, okay? If you could just have a seat back there. Before we take care of the third-party motion, can I have attorneys come forward on our...
Sorry, I guess trying to download those files while they're still streaming is taking a lot out of my computer. I can't see. I can't control anything. Okay, got it. I'm probably gonna soon, simply because, well, nobody's actually really watching. I got all these subscriber gains from my shorts, but nobody's watching my stream, so I guess it's probably just because people are watching the actual live stream instead, and if anybody else is doing reactions, they're watching those because this is my first time doing it, so But I'll give my thoughts. I hope it's not lagging like crazy because of all the crap I was trying to get my computer to do. That was pretty stupid of me to try that. Okay. But I'll just say a few things while these files are downloading, or okay, they've been downloaded, so I'll upload them later. Yeah, you can tell that there's some nervousness from Johnny Depp, and honestly, that's understandable, because he's the one who was abused, plain and simple. I mean, how else do you explain that? I know people who are on Amber's side, which, by the way, everybody who's on Amber's side is wrong. They're going to construe it and say, oh, he's trying too hard to think of what to say. Like, no. People who are abused have a hard time trying to explain what they went through because it's hurtful. It's suffering. It's scary to go back to it. I'm just going to point out that, once again, Amber Heard has never shown any signs that she's been abused. Those photos of those bruises, it's already been proven that there's such a thing as a bruise kit. Or, yeah, I think she even called it that. Which then she corrected herself and said makeup kits, which gave away that she knew what a bruise kit was and in fact used one to put bruises on her face via makeup. The bruises are not consistent to being beaten up, especially when Johnny Depp wears rings on his fingers. Like, it would look way worse than that. Amber Heard is a flat-out liar, and it doesn't. All the evidence is pointing to that. Her responses are completely rehearsed. And when she is cross-examined, she's constantly lying, and she keeps trying to turn her head to the jury to talk to them instead of talking straight to the attorney. Especially when she's being cross-examined, especially by Camille. She won't even look Camille in the eye because Amber knows that she's lying. Like, she knows, because Amber's lying. You know, if she looked at her in the eye, she would probably freak out from trying to keep looking at her because she's lying. People have a tell when they lie, and Amber has shown it. Johnny Depp is completely truthful and honest. But yeah, I'm actually just going to end the stream. People aren't watching, and it's probably because people are watching other streams of the trial. So I'll be making some shorts about the trial. I'll be putting together some highlights and clips from the stream itself. Hopefully people will check them out. I'm going to admit that it felt discouraging that people weren't watching the stream, but I'm also just going to point out that I know why they aren't. It's because of other people are streaming this, and I'm an unknown, so I'll just accept that. I'll just try to get some shorts out there, some additional highlights and clips, and I guess we'll go from there. Thank you for anybody who does happen to see this stream later, and thank you for those who have watched the clips and highlights that I will post. And thank you to those who have watched my shorts. Thank you to everybody who did watch my shorts and has given me a nice surge of subscribers I did not expect. Perhaps if I had covered this trial right from the beginning, maybe I'd have a following for this, but I'm near the end of the trial and decided to start doing this. So that would explain that. All right, anyways, thank you so much. Hold on. Microphone's still on. I'll turn off the camera. my wife is actually much more shy than I. She would rather not be on camera, but she would like to speak. So I'm going to turn off the camera. Probably just switch it to the footage of the trial as she talks over it into this very microphone. So here we go. Alright, well, should probably put this on. My head's a lot bigger than hers, so she had to readjust the headset.
Oh, that's my hat.
I know.
Hello? I'm a very shy and introverted person. I'm Paola. I'm traumatized. And I just want to say that this trial has been extremely hard for me to watch. It really hits my heart. It really shatters me that Johnny had to go through that. Because I do have PTSD and anxiety. I spent 4 years with a very abusive guy. I don't even really leave home anymore because of this man. I always fear he would come looking for me. I mean, I can go at 4 or 5 months without leaving this house. And in the end of that 4-year relationship, when I finally fought back, he called the cops on me. He made it seem like I was the one abusing him for 4 years. I was the abuser in that relationship, and it's not fair. It's not fair that he gets to live his life and get to be all happy, and I get to be stuck in my own home. I have so much fear and anxiety, and I still think about everything he's done every single day. Even though I don't really want to talk about it with my husband, I can still see my ex's face clearly every day. The things that he has done, the lying, the cheating, the drugs, the physical and sexual abuse. And it took me a long time to finally be able to actually open up to someone, and that is my husband. My husband was actually the relationship that lasted the longest, and the one that was serious, and the one that mattered to me the most. After my ex, he really made me feel like nobody would ever love me ever again, because I was so broken, and I still am so broken, and I know that. But my husband's been very patient, and he knows that I just can't do a lot of things. I don't even go out with my friends. I don't even really have friends anymore because of my ex. Everybody that I used to know was scared away because of him, because I wasn't allowed to talk to anybody or hang out with anybody. I wasn't allowed to be learning. I wasn't allowed to have any device that could connect to the internet. Besides my 3DS I had at the time, I wasn't allowed to have a phone that had internet access. Our place didn't even have Wi-Fi. I was so isolated. And after a while, I guess I just got really used to the isolation and being alone. And I was so scared of meeting new people, and my anxiety of being in public grew, and I have nobody except for my family and my husband and my one best friend. That's it. Other than that, I really feel like I really do understand what Johnny was feeling, being isolated and being alone. And that's why this person, this Amber Heard, I really hope she got what she deserves for putting him through everything. I really can't stand her. And I didn't even know who this person was until this trial. But I know I'm all over the place, but I wasn't exactly sure what to say. I just hope that Johnny could one day actually be accepted and loved the same way that I was able to find love again. I love Johnny. I grew up with him. And it's not the reason why I'm siding with him just because I've been a fan my whole life. It's also because the evidence is right there. I mean, that day that I heard Ember's laughing, that Joker laugh,
Joker laugh came from where? Context, Joker laugh came from the recording?
Yeah, the one where the recording, the one that was from the recording. I just couldn't deal with it. It reminded me of that moment where Joker laughed. It reminded me of my ex. My ex and Amber are the same person through and through, because my ex would literally act like he was a saint. He would act like he was the perfect fiance. He would act and tell everybody that it was on me, because I have depression, because I have anxiety, and because I cried a lot. But they never asked me why I cried a lot. They don't know his history of drugs, the abuse, the pedophilia. I just wish that all the best for Johnny. And one day he could be happy the same way that I am finally happy too. I love you, Johnny Depp. I love you, so fat.
Thank you, sweetheart. I love you too, Paula. Everything alright, babe? I have the camera back on, but if you stand over here, you'll be fine.
It's not fair. He gets to be happy.
No, it isn't fair. I agree. Okay. Yeah. So, as I said, she's too camera shy, and honestly, she's been through a lot. But you know what? She's not the only one. There are so many abuse victims who are absolutely pissed, angry. They absolutely hate Amber Heard for all her lies. I mean, you heard it from my wife. It's a very similar story. Her ex, a horrible human being, basically doing the same thing Amber Heard does. So,
yes, sir. How you doing, sir?
Very well, thank you, John.
Thank you. Thank you, Mr. Tobin. If you could just come to the center. Okay.
Okay, I was under the impression they were on a lunch break, but anyways, I'm gonna end the stream. Nobody's really watching. I'm gonna put together the highlights and so on, post them later. Check them out when you get a chance. All right. That'll end it. It's hurtful hearing all this from my wife. I wish that bastard had never existed. It does affect us, but I try to be as patient as I can. Thank you for watching.